Have you ever looked at your cholesterol report and immediately felt scared? Maybe your doctor told you that your cholesterol is high. Maybe someone told you to stop eating ghee, eggs, or fats. But what if I told you that cholesterol is not the villain you have been made to believe? In fact, without cholesterol, you cannot produce hormones. Your brain cannot function properly. Your cells cannot survive, and even vitamin D production becomes difficult. So if cholesterol is so important, then why are heart attacks increasing worldwide? Let's understand the truth. Namaste, I am Dr. Hitesh Chaudhari, international Ayurveda consultant and metabolic health expert. I am having more than 15 years of experience in my clinical practice. And today, I will explain cholesterol, triglycerides, visceral fats, body fat percentage, BMI, and how modern medicine, nutrition science, and Ayurveda understand and manage these conditions. So let's begin. First of all, cholesterol is a wax-like substance naturally produced by our liver. Almost every cell in the body requires cholesterol. It is used for making hormones such as testosterone, estrogen, progesterone, and cortisol. It is also required for making vitamin D, bile acids for digestion, and healthy cell membranes. Interestingly, about one-fourth of the body's cholesterol is found in the brain. So cholesterol is not a poison. It is essential for life. Now let's understand the different lipid parameters seen in a blood test. The first is total cholesterol. This simply tells us the overall amount of the cholesterol in the bloodstream. However, total cholesterol alone does not tell the complete story. The second parameter is LDL, commonly called bad cholesterol, but this name is somewhat misleading. LDL actually transports cholesterol from the liver to the different tissues where it is needed. The real problem begins when LDL particles become oxidized due to inflammation, smoking, high blood sugar, or poor lifestyle habits. In simple words, LDL is not dangerous by itself. Inflammation makes it dangerous. The third parameter is HDL, commonly known as good cholesterol. Think of HDL as a cleaning vehicle. It collects excess cholesterol from tissues and blood vessels and transports it back to the liver for recycling. Generally, higher HDL levels are associated with better metabolic health. Now let's talk about one of the most important marker, and that is triglycerides. Triglycerides are the storage form of fat in the body. Whenever we consume excess sugar, sweets, soft drinks, refined flour, or excess calories, the liver converts them into triglycerides. Therefore, high triglycerides often indicate excessive carbohydrate intake, insulin resistance, fatty liver, or metabolic dysfunction. In fact, in many individuals, triglycerides may be a more important warning sign than cholesterol itself. Now comes to the most important topic, that is visceral fats. Many people think that the fat they can see in the mirror is the biggest problem. Actually, the most dangerous fat is the one they cannot see. Visceral fat surrounds organs such as the liver, pancreas, kidneys, and intestines. This fat is biologically active. It continuously releases inflammatory chemicals into the body. As visceral fat increases, the risk of diabetes, fatty liver, high blood pressure, heart disease, PCOS, stroke, and even dementia increases significantly. This is why two people with the same body weight may have completely different health risks. Now let's understand BMI and body fat percentage. BMI or body mass index is calculated using height and weight. It is useful for screening large populations. However, BMI cannot tell us how much of our body is muscle and how much is fat. A muscular athlete and an obese person may have the same BMI. This is why body fat percentage is often more informative. Body fat percentage tells us how much of the body is actually composed of fat tissues. Higher body fat percentages are usually associated with the insulin resistance, chronic inflammation, and metabolic disorders. Now let's see how Ayurveda understands these conditions. Ancient Ayurvedic texts do not mention cholesterol by its name. However, the condition closely resembles Medoroga and Santarpanjanya Vyadhis. According to Ayurveda, excessive intake of heavy food, sweets, oily foods, combined with lack of physical activity leads to Agni-mandya or weakened digestive and metabolic fire. This results in ama formation. Ama combines with aggravated kapha dosha and causes excessive accumulation of meda dhatu or body fat. Over the time, this creates strotorodha, which means blockages of the body microchannels. Interestingly, this Ayurvedic explanation closely resembles modern concepts such as insulin resistance, chronic inflammation, obesity, fatty liver, and dyslipidemia. Now, the question is, what should we do? From a modern medical perspective, it is important to assess your lipid profile, blood sugar levels, liver health, thyroid functioning, blood pressure, and waist circumference. In high risk individuals, medications such as statins may be required and can be life saving when appropriately prescribed. From a nutritional perspective, the focus should be on reducing sugar, refined carbohydrates, ultra processed foods, and excessive alcohol consumption. Instead, prioritize adequate protein, vegetables, fruits, nuts, seeds, and healthy fats. The goal is not merely to lower cholesterol. The goal is to improve metabolic health and reduce visceral fat. From an Ayurvedic perspective, treatment focuses mainly on correcting Agni, reducing formation of ama, balancing Vikruta Kapha dosha, and normalized Meda Dhatu metabolism. So this may include lifestyle corrections, dietary regulations, panchakarma therapies, and selected herbs such as Gugulu, Triphala, Guduchi, Haridra, and Amalaki under professional guidance only. So, what is the most important message from today's discussion? Cholesterol is not the real enemy. The real enemies are chronic inflammation, insulin resistance, excessive visceral fat, poor diet and lifestyle, lack of physical activity, and disturbed metabolism. When we stop focusing only on cholesterol numbers and start improving overall metabolic health, the true healing begins. I'm Dr. Hitesh Chaudhari, International Ayurveda consultant and your metabolic health expert. Thank you for watching. Stay healthy, stay informed, and remember, health is not about lowering a number on a report. Health is about restoring balance in the entire body. Thank you.